Bupropion is a norepinephrine and dopamine reuptake inhibitor used in the treatment of major depressive disorder, MDD, seasonal affective disorder, SAD, and as an aid to smoking cessation. In this video, let's found. What is bupropion? What is bupropion used for? Contraindication. What are the side effects of taking bupropion? How does bupropion work? How to use bupropion? What is bupropion? Bupropion, sold under the brand name Wellbutrin among others, is an atypical antidepressant primarily used to treat major depressive disorder and to support smoking cessation. Bupropion was invented by Nariman Mehta, who worked at Burroughs Wellcome, in 1969. It was approved for medical use in the United States in 1985. Bupropion was originally called by the generic name amphetamine, before being renamed in 2000. In 2020, it was the 18th most commonly prescribed medication in the United States, with more than 28 million prescriptions. It is World Health Organization's list of essential medicines. What is bupropion used for? Bupropion is indicated for the treatment of major depressive disorder, MDD, seasonal affective disorder, SAD, and as an aid to smoking cessation. When used in combination with naltrexone as the marketed product Contrave, bupropion is indicated as an adjunct to a reduced diet and increased physical activity for chronic weight management in adults with an initial body mass index, BMI, of 30 kg/m2 or greater, obese, or 27 kg/m2 or greater, overweight, in the presence of at least one weight-related comorbid condition, e.g., hypertension, type 2 diabetes mellitus, or dyslipidemia. Bupropion is also used off-label as a first-line treatment in patients with ADHD and comorbid bipolar disorder when used as an adjunct to mood stabilizers. Contraindication. The drug label advises that bupropion should not be prescribed to individuals with epilepsy or other conditions that lower the seizure threshold, such as anorexia nervosa, bulimia nervosa, benzodiazepine or alcohol withdrawal. It should be avoided in individuals who are taking monoamine oxidase inhibitors, MAOIs. The label recommends that caution should be exercised when treating people with liver damage, severe kidney disease, and severe hypertension, and in children, adolescents, and young adults due to the increased risk of suicidal ideation. Side effects. The common adverse effects of bupropion with the greatest difference from placebo are dry mouth, nausea, constipation, insomnia, anxiety, tremor, and excessive sweating. Bupropion has the highest incidence of insomnia of all second-generation antidepressants, apart from desvenlafaxine. It is also associated with about 20% increased risk of headache. Bupropion raises blood pressure in some people. Pharmacodynamic. Bupropion produces dose-related central nervous system (CNS) stimulant effects in animals, as evidenced by increased locomotor activity, increased rates of responding in various schedule-controlled operant behavior tasks, and, at high doses, induction of mild stereotyped behavior. Due to these stimulant effects and selective activity at dopamine and norepinephrine receptors, bupropion has been identified as having an abuse potential. Bupropion has a similar structure to the controlled substance cathinone, and has been identified as having mild amphetamine-like activity, particularly when inhaled or injected. Mechanism of action. Bupropion is a norepinephrine/dopamine reuptake inhibitor, NDRI, that exerts its pharmacological effects by weakly inhibiting the enzymes involved in the uptake of the neurotransmitters norepinephrine and dopamine from the synaptic cleft, therefore prolonging their duration of action within the neuronal synapse and the downstream effects of these neurotransmitters. More specifically, bupropion binds to the norepinephrine transporter, NET, and the dopamine transporter, DAT. Bupropion was originally classified as an atypical antidepressant because it does not exert the same effects as the classical antidepressants such as monoamine oxidase inhibitors, MAOIs, tricyclic antidepressants, TCAs, or selective serotonin reuptake inhibitors, SSRIs. While it has comparable effectiveness to typical first-line options for the treatment of depression such as SSRIs, Bupropion is a unique option for the treatment of MDD as it lacks any clinically relevant serotonergic effects, typical of other mood medications, or any effects on histamine or adrenaline receptors. Lack of activity at these receptors results in a more tolerable side effect profile. Bupropion is less likely to cause sexual side effects, sedation, or weight gain as compared to SSRIs or TCs, for example. When used as an aid to smoking cessation, bupropion is thought to confer its anti-craving and anti-withdrawal effects by inhibiting dopamine reuptake, which is thought to be involved in the reward pathways associated with nicotine, and through the antagonism of the nicotinic acetylcholinergic receptor, AChR, thereby blunting the effects of nicotine. Furthermore, the stimulatory effects produced by bupropion in the central nervous system are similar to nicotine's effects, making low doses of bupropion a suitable option as a nicotine substitute. Half-life: 24 hours. Dose: major depressive disorder. Immediate release. Initial, 100 mg PO Q12HR, may increase to 100 mg PO Q8HR as early as day 4, may consider increasing dose up to maximum 150 mg Q8HR after weeks if no clinical improvement observed with 100 mg Q8HR. Alternatively, may initiate with 75 mg PO Q8HR. Sustained release. Initial, 150 mg PO Q-day, may increase to 150 mg Q12R after 3 days. May increase to no more than 200 mg Q12HR after more than 4 weeks if no clinical improvement observed with 150 mg Q12HR. Extended release. Initial, 150 mg PO Q-day, may increase to 3 mg Q-day on day 4. May increase not to exceed 450 mg Q-day after more than 4 weeks if no clinical improvement observed with 300 mg Q-day. Forfivo may be used only after titrating initially with other bupropion products. Aplenzin. Initial, 174 mg PO Q-day, after 4 days, may increase to usual adult target dose of 348 mg PO Q-day. May increase not to exceed 522 mg Q-day after more than 4 weeks. Forfivo XL. 450 mg PO/day without regard to food, can be used in patients who have been receiving 300 mg per day of another bupropion formulation for at least 2 weeks and who require a dosage of 450 mg per day. Patients who are currently being treated with other bupropion products at 450 mg per day can be switched equivalent dose of Forfivo XL once daily. Seasonal affective disorder. Wellbutrin XL, 150 mg PO Q-day, may increase to 300 mg Q-day. Aplenzin, bupropion hydrobromide 174 mg PO Q-day initially, equivalent to 150 mg bupropion HCl, after 1 week, may increase to usual target dose of 348 mg per day, equivalent to 300 mg bupropion HCl. Smoking cessation. Zyban, discontinued 150 mg PO Q-day for 3 days and increased to 150 mg Q12HR, should continue treatment for 7 to 12 weeks. If patient successfully quits after 7 to 12 weeks, consider ongoing maintenance therapy based on individual patient risk/benefit. ADHD, off-label. Initial, 150 mg per day PO. Titrate to 150 to 450 mg/day based on tolerability and efficacy, may administer in divided doses or in ER or SR formulations. Neuropathic pain, off-label. 150 mg bupropion PO twice daily for 6 weeks. Safety advice. Bupropion is typically classified as pregnancy category C by a regulatory authority such as the U.S. Food and Drug Administration, FDA. This classification reflects the results of animal studies that have indicated potential risks to the fetus. That's all the information about bupropion we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.